It's been called the long goodbye, and anyone who has watched a loved one endure Alzheimer's disease can understand why. The condition slowly chips away at a patient's independence and identity. November is Alzheimer's Disease Awareness Month, the perfect time to explore how the medical community is fighting back. Joining us today is Stacy Haller, President and CEO of the American Health Assistance Foundation, which funds research into age-related diseases, including Alzheimer's. Hi, Stacy. Welcome to the show.
Thank you for having me today.
This is a difficult topic to talk about, especially for anyone who has experience with this disease. But I just read a study that said we're going to see a sharp increase in the diagnosis for Alzheimer's disease. Why is that? Why are we seeing this?
Well, Alzheimer is an age-related disease. And as the boomers, the sheer numbers of Americans that are aging, are going to be more susceptible to this disease. In fact, projections over these next few decades are more than 106 million worldwide will be impacted. It's rapid. It will rapidly become an epidemic level of concern, which is why we're glad to have this time with you today.
Now, in the medical community, especially now that we're predicting numbers like this, have there been any medical breakthroughs?
There has been a recent breakthrough that we've helped to fund that is related to a simple device that's an eye detection that doctors will be able to use to predict the early onset of Alzheimer's. This is an exciting development, but it's research. Research takes time before it comes to us, but it's a hopeful move forward.
What are some of the unique challenges that Alzheimer's places on members of society?
Alzheimer's, like many diseases in our country, has a devastating emotional and economic impact to the families, the communities that we live in. Alzheimer's is a 24/7 disease with caregivers and family and friends. It means there's a loss of wages, there's a loss of time. Most importantly for the families, it means eventually their loved one won't know them.
Right.
And they have to prepare for that. It's estimated today that we lose in healthcare costs and wages more than $100 billion annually because of Alzheimer's disease.
$100 billion. That's an alarming number. You were just mentioning that you need 24-hour, around-the-clock help and assistance, and that your loved one will eventually not recognize you. Does your organization offer support for family members? What kinds of support can you provide?
Sure. We're more than 30 years old, and we have a series of resources that your viewers can look through by looking at our website. There's an Ask an Expert capacity, so you can write your question online. Most importantly, potentially for the viewers, are some resource books that are available online or through print request that can really tell you a little bit more about the early stages, Alzheimer's, healthy living, what to know for a caregiver, what to know if you're the one that has Alzheimer's, and really help families. These are vetted, trusted resources that will really give you the foundation and the connections to help you get through this difficult time.
For our viewers who are watching this morning, who are thinking about their future as they age, are there any ways to reduce your risks?
You know, it would be great to have some conclusive studies that have been done that could say this is what you can do, and hopefully with research and the investment in research we'll get there. But today it's pretty common sense. Healthy diet, exercise, and activities that keep your mind active may be able to help reduce the risk of Alzheimer's.
Maybe Scrabble games and
Scrabble
things like that.
games, Sudoku, all those things that you like to do. Try to learn something new and different that you haven't done before and keep active. That's the best help we have today with the information that's available from our researchers. We've invested over $110 million in research to try to find that cutting-edge, innovative research to attack this and other age-related diseases. And in that process, there's been 2 Nobel laureates that we've been able to fund. So research is the key to a cure.
Well, you've certainly helped inform us this morning. We appreciate you being here.
Thank you.
Thanks for joining us. Now, for more information on reducing your risk, early detection, and caring for a loved one with Alzheimer's, head to ahaf.org and click Alzheimer's.